Good morning. If you have decided to study and you want to become a professional hypnotherapist, keep watching our training videos about clinical hypnosis. Hypnotherapy is an effective technique with which you can help and improve the quality of life of a large number of your future patients. Remember, read the description of this video where you can find a link to free training classes on clinical hypnosis. And also, you can download several ebooks also free. The information in this video is extracted from our book Direct Clinical Hypnosis, Deep Hypnosis of our publisher Clinical Hypnotherapy, registered with ISBN. Direct Clinical Hypnosis, Diagnosis and Treatment, Part 2. Treatment. Once we have the diagnosis, proceeds to design the appropriate treatment. This will depend on the diagnosis. In hypnosis, treatments are personalized, since each patient is a world and this has acquired his disorder in a different way than another. A patient can present signs and symptoms similar to another patient, but not exactly the same. Also, the patient can be male, female, young, child, single, married, etc. That is why we must tailor the treatment to the individual patient, taking into account the patient's sex, age, culture, religious beliefs, working situation, marital status, etc. It is not the same to treat, for example, a depressive priest as it is to treat any other person with the same disorder. That is why it is important to always personalize the hypnoid treatment. The treatment in direct clinical hypnosis differs a lot from the treatment in indirect clinical hypnosis, Ericksonian. To induce the patient into trance, there are many techniques. One can use the one that is most convenient. We use the combination of systematic relaxation plus visualizations. That is to say, we use as an induction procedure to hypnotic trance suggestions for relaxation, calm, and well-being, and also instructions to imagine, visualize. When we talk about treatment, things change. Normally, there are two main fields within clinical hypnosis: direct and indirect. Indirect hypnosis is based on indirect suggestions, mainly based on fables, stories, anecdotes, stories, etc. All with the presence of metaphors and analogies. Then they extrapolate the story to the patient. If that person achieves it, you can also achieve it. The direct basis is treatment on direct suggestions. As far as the treatment is concerned, it is more direct, redundant. From now on, you're going to do such and such a thing. Within the treatment in direct clinical hypnosis, we have two main sections: the primary exercises and the secondary exercises. Before the therapy. Let's start with the therapy. For this, I will put my dedication, my inspiration, my professionalism, and all that is on my part. The rest depends on you. Your part is necessary: imagination and visualization. You know that if you want to see a tree, you also see a valley. If you want to see a valley, you also see a mountain. If you want to see a mountain, you climb a cloud. And if you want to see everything, you must close your eyes and just think about it, because imagination creates at night everything that ceases to be perceived in the daytime. Visualization goes a little further, for it is our imagination applied to whatever goal we wish to achieve. It is indispensable also on your part concentration, effort, and above all the desire to restore yourself. Also is motivation to become aware that through will and mind you will achieve it, because the mind can't do anything. If you're interested in learning more about clinical hypnosis, watch our next video, Direct Clinical Hypnosis, Diagnosis and Treatment, Primary, Secondary and Tertiary, Exercises Part 1. Remember, read the description of this video where you can find a link to free training classes on clinical hypnosis, and also you can download several free ebooks. If you have any questions, add them in the comments area. On this topic and many others we'll talk about in the channel and in the videos that we'll publish. So if you're interested, do not miss our next videos. Thank you very much.